very much. We're now going to move on to our final speaker and change directions just a little bit. So our final speaker is Dr. Sabina Paul. Dr. Paul is full professor of urban and environmental psychology at the University of Vienna. Over to you, Dr. Paul.
Thanks very much. I'm just sharing my screen. Okay, here we go. Thanks very much for the invitation. I'm thrilled to be here. It was already a really interesting session. So as you said, I'm bringing in a bit of social science, behavioral science, psychology, whichever label you want to apply here. And as the others, I want to say something about conflict of interest. I don't have any. I'm 100% university employed, but I do collaborate and talk with for various groups. And I have received a range of funding also from different groups. So that's shown here. Where did it start? We heard earlier from Carol Lamanda-Law that early research was in the marine environment and was looking at plastic found in these natural environments, to the surprise and the shock of many scientists and many people. And switching to the public perception angle, this is very early data around 2012 that we received in a large project on marine litter. We know marine litter, that was demonstrated earlier, it's about 80% plastic. And even at that point, this was not a project about human health, it wasn't a project about food. People told us they were concerned about human health threats coming from marine litter. So really diffuse category, we didn't expect this. The highest category of perceived threat was still the marine environment. The appearance of the coast also featured, but human health was already third. So that was a surprise at the time. And we can pursue this line of thought a bit more. So we were particularly interested in this human health angle. And I should say this was not a representative sample. This was a fairly large sample, but not representative. So we need to think about the quality of the data. And what we did a few years later was run a large European study, still focusing on marine threats, but asking how concerned people were about the human health impact specifically. So here we totally focus in on the human health angle, and we ask people, which of these are you concerned about? How high is your level of concern? And I hope you can see from this overview that plastic pollution was number one on the right-hand side, closely followed by chemical or oil pollution. And this is on a rating scale from 0, not at all concerned, to 6. It's only showing the top half because generally people are concerned about various health risks in the context of marine environments. But it was very consistent that those two were the top. Same across 13 countries. This was EU and Australia. Only for Poland and Greece were the first top two reversed. So they said chemical oil pollution first, followed by plastic pollution. So we're still within the marine environment. What's the link to food? I haven't mentioned food yet, and this is, I know, the interest of the organizers and the audience as well. So this very large study, we wanted to follow up by just delving in deep and asking people, what did they think about plastic? What did they think about plastic, in particular in the context of cosmetics, which has been covered a lot in the media? So we ran a rather smaller scale study, not 15,000 plus, but around 20, 30 people. I can't actually remember the exact number now, and a qualitative study. So we gave these people samples of microplastics found in cosmetics, particularly in facial scrubs. And we got them to look at these, we got them to handle this, and then we asked them their response. So very open and very qualitative. And you can see some of the responses here. There were different groups of participants. Generally, they were shocked seeing this firsthand, how much small particles of plastic there were in the cosmetics. They started thinking about the general impact. Is it dangerous for us, for the world around us? And then the thing I want to point out is that they also spontaneously started thinking about human health, particularly the food chain. So they said, you know, is this to do with seafood? If I use this, it goes down the drain, it gets into the sea, it doesn't all get cleared up on the way. And then the animals eat it, we're eating the animals. So very spontaneously, this was not the main point of the study. Again, people made the link. They talked about the link to food. So there we have a link to food. It's a big emerging topic. We've already heard this from the others, and it's one that we're following up in a project now with EFSA and BFR. So I want to highlight a few of the things we've already done. EFSA, the European Food Safety Authority, BFR is the German Institute for Risk Assessment, and we're working with their social science teams here. So again, it's a different angle, different perspective on what we've heard so far. In this project, we have a qualitative stage similar to the research I've just shown you, and we've got a quantitative stage, which is much larger representative sample. So far, we've finished the qualitative stage, and we're focusing on 2 European countries, on Germany and Italy, because in the Eurobarometer survey, they were shown to have different levels of concern. This is shown on the left-hand side, where for Germany, we have between 30 and 49% of citizens who are concerned about microplastics, again, in a representative survey, great resource on the Eurobarometer. In Italy, the concern was slightly lower, between 10 and 29%. And I've put the link down there if you're interested in looking at this. And we're focusing here on a range of issues and topics. For one, we're focusing on impacts on the natural environment and on human health, because the two are connected, and we've seen that initially the concern was for the natural environment, for wildlife, etc., and only recently has it become stronger for human health. And we're focusing on food and drink. Of course, we're interested in this topic here. And in our first phase, where we ran qualitative interviews in the 2 countries, we were particularly looking at the perceived pathways, the risk perception, perceived impacts, perceived control, what solutions there might be, and where the responsibility lies. So I want to just run you quickly through a few initial findings here from the interviews. Thanks very much to my colleagues at EFSA and BFR who've prepared this. So some of the themes: microplastics were perceived as small, artificial, man-made, and somehow linked to chemical. And generally the response was, these are harmful and worrying. There's always an example underneath, but I won't read that out. They also said microplastics were associated with other environmental issues, with human health, with food safety. We saw that in the first study already. And what people like to do here is they like to draw analogies. Sometimes to a scientist, they might be a little unusual, but this is what people do. They try to make sense of this new threat, of this new risk that they're facing. And they also linked microplastics to blue environments, meaning natural blue environments such as oceans, rivers, etc., but then also to drinking water. So that's the example here. And they thought about impact of microplastics, and they told us this is very negative for both environmental and human health. This is quite a nice quote. They make a mess. Unfortunately, anything unnatural you put in a person's body, they might cause all these different illnesses. Remember, this is people's perceptions. They're trying to make sense of it. They're thinking, what could this possibly lead to? And they are quite worried about lots of different things. This is also an interesting quote, because later on I'll talk a little bit about this unnaturalness that people perceive. And that's the main concern. Plastic is just not seen as a normal, natural thing. Then we have a lower perceived control. So people say, we just don't know what to do about this. And I saw a few questions in the chat, in the questions and answers already, that referred to what do we do to protect us and our families. And finally, the responsibility question basically said it's not up to us, the individual, it's up to other people. So this is just an overview of the initial qualitative results. And we're now extending this to the bigger representative survey, to the more quantitative side. And we haven't started collecting data on this. We're still working on the tool, but there will be further work on this coming forth. So I've told you quite a lot about research that asks people to report how they feel, to rate things, etc. And something I'm often asked is, do people tell us the truth? You know, do they try to change it somehow? Maybe be a very good participant in these studies, or have some social desirable responding. And I'm quite excited. I found this study. This is a very new study, nothing to do with our lab, but it's asking about 2 types of attitudes or perceptions: implicit and explicit attitudes. And the point is that you have different ways of measuring attitudes. Sometimes you just ask people to report what they think. Sometimes you can do this in a more implicit way. And I want to start with the explicit attitudes they found. They looked at particularly this love-hate relationship with plastic. Of course, it's very useful, it's very convenient on the one side, but it's also seen as very negative once it ends up in the environment. And they said it matters what exactly you ask about. Do you ask about packaging, which is still fairly useful? Do you ask about plastic pollution or waste or microplastic? So here's the explicit question: how good or bad do you think these things are? And I've tried to color this. I hope this works even if you're colorblind. So people say it's negative. Packaging, waste, and microplastics are all negative. Then they added an implicit measure. And just to explain this briefly, this is a way of measuring automatic attitudes. It's based on response times. So the idea is that you're quick when you're looking at congruent meaning and concepts, and you're slower when you look at incongruent. So by pairing concepts and words, you can then gain an insight into the implicit attitude. So that's what they've done here. And what you get is called a D score, which represents the implicit attitude, the automatic attitude. And again, I've colored this. So the meaning of this D score is above 0. It's a positive association between these concepts and positive words. And below, it's a negative association. And what you can see again is this is fairly consistent with the explicit work, in that most of these scores are negative. It's just microplastic that is a little more spread out. So this is the first part of this piece of research, where they look simply at bad and good. What's the overall sense people have about these concepts? They then did a second step where they looked at risk versus safety, or the degree of risk. First of all, and this is interesting in itself, the explicit attitude about packaging, waste, and microplastics. So here people were asked, how high do you think the risk is? And you can see this on the left is the health risk. It is seen as relatively high, but the one that sticks out is microplastics. So that seems to be particularly high. On the right-hand side, you can see the environmental risk rating. And then they also added the implicit attitude. And you can see here, it's a lot more neutral. So people aren't quite sure what to make of these in terms of risk or safety. So they all sort of hover around the midpoint. The only thing that's fairly negative is waste. I'm excited about this because it's a really nice way of applying some good psychological science to these measurement issues. How do we get to people's risk perceptions? It's not the very best study one could run. It's a convenient sample. It's mostly young females, so there's a problem with the sample, clearly, but it's a method we should consider more, I think, to validate what we find in other surveys. So that's why I'm excited about it. That's why I wanted to present this today. So far, I have talked about consumers, about citizens. I wanted to add in one other data set that's not from consumers, not from citizens, but it's quite high-level global approaches to plastic and microplastic. So we were asked by UNEP to do a stock take of solutions, of actions, that's their phrasing, that reduce the flow of marine plastic and microplastics to the ocean. So this was quite high level. The invitation went to all member states and major groups, and they were just invited to respond and explain all the actions they were taking. And we asked many, probably too many questions around this. And the actions took different categories that we discussed and agreed with UNEP. So the types of actions were from legislation, standards, rules, to working with people. So this would be community awareness, that sort of thing, to technology, to monitoring and analysis. And it's important to stress this is a snapshot of action. It's not exhaustive. It was difficult to get the data together. Why am I showing you this? Oh, and this shows where the actions were placed. So we've got a really good spread around the globe. Why am I showing you this? Because one of the questions we asked was, what type of impact or harm is your action related to? And people here could select all of these issues. And what was interesting to us is that they selected human health and well-being as the third most category. So again, we see marine organisms biodiversity at the top, because people are clearly keen on protecting the natural environment, ecosystems, etc. But actually human health and well-being was in this high-level group of respondents who look after all sorts of actions that their governments, that their group is doing. Human health and well-being was right at the top there. So it's just another indicator, perhaps, how important human health and well-being is becoming in the context of microplastics and plastic. Right, I want to step away a little bit from the specific data now and just talk a little bit about risk perception processes. What do we know about this? Here's a slide that explains a little bit about the cognitive and social processes of risk perception. Classic quote from Slovak, very important risk researcher at the top: danger is real, but risk is socially constructed. That's really, really important, because if you monitor things, if you test things in the lab, that's not the whole story. It depends how people respond to it, how policymakers respond to it, and that's the social construction. Risk perception is defined as a subjective judgment about risk, and it's clear to see that the public or non-experts often have to rely on experts. They can't go to the lab and do these studies themselves. They might go to the beach and find microplastics, but they don't know what this means. So it becomes a question of trust and how you communicate what you're finding. And that's absolutely crucial from a social science point of view. It's also clear that experts and non-experts and various groups in society may disagree. And this creates uncertainty. Again, it may create distrust, and we need to deal with this. So it's really important that we're transparent, that we communicate clearly to avoid these things becoming a proper conflict. So there are various biases and heuristics. I can't go through these at the moment, but just to know there are things we know about these processes. And finally, just to say why are people so worried, particularly about plastic. We said earlier, it's perceived as unnatural rather than natural. It's often portrayed to affect vulnerable groups, such as babies. There are particular exposure pathways that concern people. Food and air was mentioned. It's a large number of people exposed, plastics everywhere. The lack of individual controllability we saw in the interviews as well. And there is this huge uncertainty at the moment and lack of knowledge. So these are the factors that explain why people are so concerned. And I know I'm pretty much at the end of my time, so just want to raise this question of what is enough evidence, what's the right kind of evidence. Really interesting. We put a big report together. I was the vice chair of the report for the European Union Chief Scientific Advisors, and there was a big debate afterwards about the level of evidence we need and how it may or may not be consistent with the concern. A few ideas on horizon scanning. There's clearly rapid development. Some of the things that are very much on the forefront of people's minds are the additives, the contaminants, the mixtures, not just plastic per se. Said about the exposure pathways. I think we need to think about the holistic approach, mention the kind of evidence that we need. And I'm just scanning through this, coming to my final slide, summarizing. People are concerned. They make the connection between plastic pollution and human health. They use different criteria, experts and non-experts. It's not just the question of who's right and what's wrong. That's the wrong question, in my view, to ask. We're still quite at the start with social research. And yeah, I want to come back to this holistic view. We need to think about trade-offs, co-benefits, undesirable substitutions, what Dr. Coffin called regrettable substitutions. And we need to include social data here. And that's just a thank you slide to people I work with.
Thank you very much, Dr. Paul. And I think what I found most interesting about your presentation is as you were going through the perceptions, I could see that going through the questions that we're receiving in the Q&As, and you had obviously done this presentation before seeing any of those questions. So we just have one question for you before we move to the panel. And it's, will you be asking as part of your research about what actions people will take to reduce their perceived environmental and human health risks, including their own exposure?
Yes, we are just developing this. And it's a really tricky question because when we started talking to people about this, they said, I don't know, I can't see it. Where do I start? So we're also now thinking about particular pathways. One project I'm involved with is called Limnoplast. And we've decided to focus particularly on fashion, clothes, and fabrics, because people can do things around that to do with washing, buying different materials, maybe buying less, reducing the overall amount. So we are asking exactly that question. but it's a tough one. And when you ask to people, they often say, I'm helpless. I don't know where to start with this. Thanks for the question.